Hello, my name is Ronald Rook. I'm an orthopedic surgeon. I specialize in sports medicine, which includes shoulder, elbow, and knee reconstructions and total joint replacements. Been using Dynasplint for about 10 years now. I really find it useful for the total joints and for the stiff joints post-op and pre-op. When we're looking at things like a knee replacement, most patients pre-operatively are already stiff. Post-operatively, after we have restored their motion, the knee has a tendency to fall back to its old state of stiffness. And it's very easy to see patients in the first post-op visit already starting to fall back into those bad habits. And the Dynasplint's wonderful for that situation.
So in a time factor, when would you begin to see that at the post-op visit? Would it be 2 weeks, 10 days, 5 days?
Certainly everyone's different, but early on, it's easier to treat.
Okay.
The knee still tends to be a little bit more malleable and will respond a little bit better. Once you've waited months, I think the problem can become more static, and then it's going to be very difficult to treat. But early on, I think the knee responds well. So I have a real low threshold to start the Dynasplint early.
What about some of the diagnosis that you are performing surgically to repair, or I know you do a lot of replacements for the knee. What other knee diagnosis?
Any type of stiff knee problem, so a patient that's had stiffness as a result of a meniscal problem or a ligament issue. Frequently the ligament issues are more of a laxity problem, but post-op they can certainly get stiff. Patients that have bucket handle meniscal tears or things that prevent the knee from coming into full extension or flexion, they're going to struggle afterwards in some occasions, and they'll benefit from the Dynasplint as well.
And how important is range of motion in your post-operative care? Rehabilitative stages?
For me, motion is almost everything. The average patient comes to me with a painful knee, and the only thing worse than a painful knee is a stiff, painful knee. So definitely for me, you want to see a good range of motion for these patients.
And then after they've achieved the range of motion, they can begin other strengthening,
absolutely,
functional activity.
Motion is function, and so once the motion tends to improve, the other things come along with that.
And if a patient has extension and they're still lacking that last 5 or 10 degrees, why are you prescribing for those patients?
Of extension? That's the hardest part to gain. And unfortunately, trying to stand on a bent knee, anyone that's tried to stand on a knee with only a 5-degree contracture or a 10-degree contracture, while it doesn't seem like much when you're looking at it from a numeric standpoint, your quads are in a constant state of contraction to keep you from falling on your face. If you can lock that knee into full extension, it's incredible how much easier it is on the knee and the leg. Okay. I think it's important for patients to understand that a failure to obtain full extension or flexion or whatever we're talking about in terms of a motion loss is not necessarily a negative for the patient, meaning that they haven't worked hard enough or haven't done the appropriate things. You can put in all the time, you can do all the appropriate stuff and still have some difficulties. The advantage to the Dynasplint, particularly the knee, it's very portable, so if you have a patient that travels frequently, you can travel with this relatively easily, and while you're not able to see the physical therapist on a daily basis, you're certainly going to be able to use this on a daily basis.
And spending the time trying to get that extension,
yes,
it's soft tissue. It really
yes,
doesn't have an immediate effect on the joint per se.
Sure.
It is lengthening soft tissue,
yes,
preventing contractures.
Yes. And the other advantage to this is, even let's assume that you aren't traveling, you're going to see a therapist most of the time 3 times a week, maybe 5 times a week if you're really fortunate. Almost no one sees a therapist daily. This can be used 2 or 3 times a day.